PPIs proton are associated with decreased bone density calcium malabsorption, which increases the possibility of fractures of the spine, hip, and wrist. It causes acid suppression that otherwise would have prevented pathogens from more easily colonizing the upper GI tract. This leads to increased risk of pneumonias. It can also increase the risk of C. diff-associated diarrhea. Unclear cause. Receiving A or Bs for a UTI will further increase risk of C. diff infection. Take medication prior to meals. PPIs don't affect BP. Increase calcium and vitamin D intake to prevent osteoporosis. Phenytoin, anticonvulsant. Toxicity. Gait disturbances, ataxia. Bisphosphonate, alendronate, risedronate. Bisphosphonates are a class of drugs that prevent the loss of bone mass, used to treat osteoporosis and similar diseases. Drink extra water and stay upright for 30 minutes after taking the drug to prevent esophagitis. Jonacrosis is a toxicity SS, lithium mood-stabilizing drug and albuterol bronchodilator. Short-acting beta-agonist toxicity. Tremors. Dialysis. Peritonitis is the most common complication of dialysis. Chills may indicate elevated temp, sign of infection, and rebound tenderness, a sign of peritonitis, inflammation of the peritoneal cavity, with cloudy effluent. Abdo pain also present. Assess peritoneal fluid for C and S. Clients receiving peritoneal dialysis often have diabetes, and glucose dextrose is the osmotic agent in dialysate. Monitor glucose levels closely. Regular insulin can be added to the dialysate before the solution is instilled, or it can be administered sub to control glucose levels. Ulcerative colitis, chronic disease, inflammation of the large intestine, results in urgent, frequent bloody diarrhea. Abdo pain, anorexia, and anemia. The Gafat-Guyac fecal occult blood test. Correct sequence of test. Obtain supplies. Wash hands. Don non-sterile gloves. Open the slides flap and use the wooden applicator to apply 2 separate stool samples to the boxes on the side. Wait 3-5 mins. Open the back of the slide and apply 2 drops of developing solution to the boxes on the side. Wait 30-60 seconds. Document the results in the EMR. This test is used to assess the microscopic blood in the stool and as a screening tool for colorectal cancer. Assess recent consumption of red meat or Vit-C in the last 3 days, or using certain meds, aspirin, anticoagulants, iron, ibuprofen, and corticosteroids, as they can interfere with the results. If the test paper turns blue, the test is positive and the stool contains blood. MAP. Average pressure within the arterial system felt by the vital organs. A MAP 60 is necessary to adequately perfuse and sustain the organs. When it falls below this number, the organs can be underperfused and become ischemic. Normal MAP, 60,105 mm Hg. Formula, CBP plus DBP x-3. Systemic lupus, an autoimmune disorder in which an abnormal immune response leads to chronic inflammation of different parts of the body. Mild skin, muscles, joints, severe affecting kidneys, heart, lung, blood vessels, CNS, lupus nephritis, increased creatinine, BUN, and abnormal urinalysis protein RBCs, cellular casts, a positive on a anti-nuclear antibody titer, 140, elevated ESSER, anemia, mild, leukopenia 4,000, and thrombocytopenia 150, 000 indicates the presence of SLE and is expected. Cardiac tamponade, complication of pericardial effusion, second per second, muffled or distant heart tones, narrowed pulse pressure, jugular vein distension, pulse, paradoxis, widening systolic pressure of 10, dyspnea, tachypnea, tachycardia. Treatment, emergency pericardiocentis, Beck's triad, hypotension, muffled heart sounds, distended neck veins. CSF, assessed for color, contents, and pressure. Normal CSF is clear and colorless, and contains little protein, glucose, minimal WBCs, no RBCs, and no microorganisms. Normal CSF pressure is 60 to 150 mm 20, CSF is collected via lumbar puncture or ventriculostomy. Before a lumbar puncture, empty the bladder before procedure, performed in the lateral recumbent or sitting upright position. Help widen space between the vertebrae and allow easier insertion of the needle. A sterile needle will be inserted between the L3-4 or L4-5 interspace. Pain may be felt radiating down the leg, but it should be temporary. After the procedure, pain may be felt radiating down the leg, but it should be temporary. After the procedure, lie flat with no pillow for at least 6 hours to reduce the chance of spinal fluid leak and resultant headache. Increase fluid intake for at least 24 hours to prevent dehydration. Bell's palsy, inflammation of cranial nerve. 7 motor sensory alterations, corticosteroids to reduce inflammation, and TOD eye or oral care. Eyelids don't close properly, causing eye dryness and risk of corneal abrasions. Weakness of the lower eyelid may cause excessive tearing due to overflow in some clients. Facial muscle weakness results in poor chewing and food retention. PT, teaching. Eye care. Use glasses during the day. Ear a patch or take the eyelids at night to protect the exposed eye. Use artificial tears during the day as needed to prevent excess drying of the cornea. Oral care. Chew on unaffected side to prevent food trapping. A soft diet is recommended. Maintain good oral hygiene after every meal to prevent problems from accumulated food parotitis. Dental caries. Vision, balance, consciousness, and extremity motor function are not impaired. Assessment. Ask PD to smile, frown, raise eyebrows, open lips to show teeth to assess this nerve. Any asymmetrical movement are documented, and if unexpected, the HCP can be notified. My BP and serum K levels are checked prior to administration of ACE inhibitors, HR checked prior to beta blockers. Aspirin is given to clients with normal platelet counts 150,000 and 200,000. Simvastatin is a lipid-lowering med given to all clients with elevated triglycerides and LDL cholesterol. It is usually given in the evening. Metoprolol given post-MI to reduce the risk of reinfarction and occurrence of HF, S or E. Bradycardia. Hold med and notify HCP. Docusate sodium, stool softener. Clients should not strain during a bowel movement. D or T risk of producing a vagal response, putting the client at risk for bradycardia and other dysrhythmias. Aspirin given as antiplatelet to help reduce inflammation and inhibit platelet aggregation. Assess platelet count, hemoglobin and hematocrit count prior to administration. Lisinopril, ACE inhibitor, given post-MI to prevent ventricular remodeling, hypertrophy, and progression of HF. They can cause hyperkalemia, so need to assess K level. Assess BP prior to administration as it can lower BP. Troponin, cardiac-specific serum marker that is a highly specific indicator of MI and has greater sensitivity and specificity for MI injury than CK or KCAM. Serum troponin I increase 4 to 6 hours after onset of MI. Peak at 10 to 24 hours and return to baseline in 10 to 14 days. However, MI is not diagnosed alone by serum cardiac markers. ECG and client health history along with history of pain and risk factors are also used to make diagnosis. Antihypertensives can cause rebound hypertension and a possible hypertensive crisis if not taking medications. This is a major issue in long-term management of HTN. Poor adherence, S or E, fatigue, dizziness, erectile dysfunction. Nicardipine Cardini, a prototype of nifedipine given during a stroke presentation brain attack, CCB vasodilator and takes effect 1 minute for administration. Monitor BP and ensure it does not fall too quickly or slowly as this would extend a stroke. Hypotension can occur, with or W or O reflex tachycardia. D or C drug of this happens. Permissive HTN during first 24 to 48 hours allows for adequate perfusion through damaged cerebral tissues. The blood-brain barrier is not longer intact after the BP reaches to 20120. Need to lower the BP gradually, and the CBP should not fall below 170. Torsades D points, ventricular tachycardia, due to increased magnesium, occurs with haloperidol, methadone analgesic, Ziprasidone antipsychotic, erythromycin antibiotic to treat gram-positive infections, similar in effects to PCN spironolactone aldactone, K-sparing diuretic, BNIP, hormone released by the heart muscle in response to mechanical stress stretching. BNIP levels are usually elevated 100 pg or mol in clients with HF, and the prescription of Lasix is expected.